A measles outbreak in Texas has grown to 159 cases. Texas officials said 22 people have been hospitalized. The CDC says it is now on the ground to respond. In the CDC's first public statement on the measles outbreak, it suggested vitamin A as a type of supportive care.
That's right. Joining us this morning to discuss that statement is our 9 News health expert, Dr. Payal Kohli. Dr. Kohli, great to have you back with us.
Good morning, guys.
All right, does measles have a treatment?
Well, that's the hard thing about measles. It's a virus, and we don't have an antivirus that targets that specific infection. So really what you do is supportive treatment. You try to get them through the infection, give them fluids, and try to really minimize the risk of complications, because we know that unvaccinated individuals who get measles, they have a 20% chance of ending up in the hospital, and complications can be severe like blindness and pneumonia, even death.
All right, so this whole conversation, when you reached out about this topic, I was like, I'm hearing so much about vitamin A when it comes to measles and infected patients. Does it work?
Yes, interestingly enough. So the data comes from sort of two sources, mostly around the world, not so much in the United States. But the first thing we found is that if you're vitamin A deficient, especially as a child, your risk of having more severe complications such as blindness is much higher with measles. Yes, so it's one of the preventable causes of blindness by measles is giving somebody back vitamin A. And the studies where they supplemented vitamin A, people seem to recover faster, kids especially, and have less risk of complications.
What's the best way to get vitamin A?
So for us, we're not vitamin A deficient, so we usually get it in our foods. But many of these studies were done across the world where there's a high risk of vitamin A deficiency due to being malnourished. So certainly if you're vitamin A deficient for any reason, whether it's malnourishment or if you have some kind of a GI problem, you're elderly, you could benefit from vitamin A supplementation during measles.
I want to ask for clarification about the food part of it, because we talk about this with you a lot. Yes, you would expect that we get vitamin A in our food. Do you have to eat specific healthy foods though, or?
So most of our food in the US here is fortified with vitamin A.
Okay.
And you want to be sure not to get too much vitamin A, because vitamin A can cause both acute and chronic toxicity. It's a fat-soluble vitamin. Once it gets inside our bloodstream, it sort of stays in our tissues. But plant-based foods like spinach and meats and a lot of the things that we eat in our everyday diet have vitamin A. So the likelihood of us being vitamin A deficient here in the States is extremely low unless we have some sort of a chronic GI problem.
Okay.
Is there a way to test? Like, I'm thinking about my kids.
Right.
Like, are they getting enough vitamin A? How do we know?
Certainly you can check vitamin A levels, but I would say if your child is following a well-balanced diet, it's probably not worth testing. Now people ask if vitamin A can prevent measles and whether they should start supplementing with vitamin A, especially if they're one of these states that has measles. The answer is no. It's really only, the vaccine that's going to prevent you from getting measles. But making sure if you live in a part of the world that is vitamin A deficient, or if you have a child that gets measles, most children that get a severe case of measles should get vitamin A supplementation. And it's a very specific dose because, again, you want to try to avoid that toxicity. And vitamin A works in our body to boost our immune cells, fighting cells. It helps to sort of reduce inflammation, and it helps tissues to heal. And we think that's the mechanism by which, in a really severe measles infection, it's one of the few treatments that we have that could potentially have some benefit.
There's a lot of worry, understandably, about kids catching the measles right now. When you talk about getting those vitamin A supplements if a kid does contract the virus, is that on top of having the vaccine, or is that even a kid that maybe hasn't gotten that vaccine yet?
Everyone who gets a case of measles who's a child should probably get vitamin A. If it's severe measles and you're an adult, you should get vitamin A as well. But don't go take it yourself, because it's very specific dosing and the doctor has to give it to you. And it's at a specific time interval, again, to prevent toxicity, because you can get acute toxicity from it. But if you test positive for measles, whether you've had the vaccine or not, talk to your doctor about whether vitamin A supplementation makes sense.
That's really interesting. Dr. Kohli, thanks so much for coming in. Appreciate it.